Hello, my name is Justin Thomas. I am an interventional pulmonologist at Eisenhower Health. I am board certified in interventional pulmonology, pulmonary diseases, and critical care medicine. One of the things that I do most frequently is diagnose lung cancer. And lung cancer is the leading cause of cancer mortality in the United States. It surpasses pancreatic, colon, and breast cancer combined. Unfortunately, lung cancer is caught in the late stages in the majority of cases, over 80%. So the key to really treatment of lung cancer is diagnosing it in the earlier stages so that we can cure these patients. One of the ways that we do that is by doing biopsies of the lungs, biopsies of small nodules in either the periphery or in the more central portion of the lungs. Right now, what we use is CT-guided biopsies, which unfortunately carry a risk of about 15 to 40% chance of collapsing somebody's lung. They go through the outside with a CT-guided camera and can diagnose lung cancer that way. But again, pretty high complication rate of pneumothorax, collapsed lung, and bleeding. What I've done since I've been here is started electromagnetic navigational bronchoscopy. And what this does is allows us to guide a catheter out into the very deep recesses of the lung to biopsy these little tiny nodules way out deep in the lung so that we can avoid those CT-guided biopsies. The problem with that current technology is it has about a 65 to maybe 90% yield as far as picking up cancer in these small nodules out in the periphery of the lung. And all of that is very dependent on where the nodule is located, on whether there's a nice clear airway that goes to the nodule, and also the biopsy techniques that we have through this sheath that we guide out to the edge of the lung. So unfortunately, with this current technology, we're not able to actually confirm we're in the spot as we're taking biopsies. So what I'm asking of you is to help us obtain an instrument called Robotic bronchoscope. What this allows us to do is go out into those far reaches of the lung with actual visual localization of these nodules. So we're actually able to see the nodule way out in the deep recesses of the lung. With our current technology, we can only go so far out with the bronchoscope, and then we're guiding out a virtual catheter to the spot. Here with the robotic bronchoscope, we're able to actually get to the nodule, all the very edge of the lung, and actually see the nodule in front of us so that we know what we're looking at, we're biopsying, and we're getting answers. Eisenhower Health can be the very first to obtain this robotic bronchoscope in Southern California. This would allow us to diagnose cancer much sooner in a minimally invasive way and be able to get these patients on the road to a cure much faster.